1099 therapist, how to reduce missed visits. As we know, missed visits equals missed income for you and the agency. So the missed visit percentage is something you should be tracking. And if it's low enough, you can use it to negotiate higher rates. During my 18 years as an independent contractor, I was able to use this metric to effectively negotiate higher rates. And my percentage was always under 10 and usually under 7%. So that's something to strive for. As a 1099 therapist, you should be working for multiple agencies and have the ability to restaff patients, because it is those patients that keep canceling that are going to drive up your percentage of missed visits and also increase the possibility of a domino effect with other missed visits. Now, most therapists do the following after seeing a patient. They'll say something like, "You did great, see you next time." But the problem is, if the patient doesn't feel the same, for example, if the patient is thinking, "She thinks I did great, but I didn't," then the patient will feel very much disempowered. And you have created now a power struggle where the patient doesn't want therapy because they think it's not working and they're definitely not being heard. So this is when you start getting the patient to not answer your calls, text, etc. So you want to reduce missed visits. This is the key, by being patient-centric. This patient right here says, "I feel better and I want to see her again." As in, I want to see the therapist again. And feeling better, folks, is not always physical. So this is a better way to be patient-centric and patient-empowering, which will lead to lower missed visit rates. And one thing we got to do is deal with reality. We may think as a therapy professional that the session went awesome, but the patient may think completely the opposite. So it's okay for us to deal with the reality from the patient's perspective and at the same time not take it personal. So for example, let's say that the patient, from their perspective, did have a good session, and you ask them, "How do you think it went during this session?" And they'll say, "Well, I guess I'm not as wobbly when I was putting on my clothes." At that point, what you should do is say something like, "So you're saying your standing balance is better. Isn't that one of your goals?" Now, why are we asking this particular question? Number one, you want to reiterate what the patient said, because you want to let the patient know that you've heard them. You also want to align their goals with the therapy goals. Why? Because the message is this: what matters to you matters to me. That the patient's life goals are the same as your therapy goals. Now, after you've asked this question, you want to pause. This is key right here. This is critical. Why? Because it allows the patient to marinate on what you just said and get a yes. See, because the patient right now is assessing you. They're assessing how they feel about you. And you want them to assess you now. This is when they're making up their mind to see you again or not. You don't want them assessing you when you call again to maybe secure the next appointment. No, you want the yes right now. After they've said yes, then you're going to say, "I'm looking forward to see how you'll improve next time. Your next appointment is blank." You're putting yourself in their future, and you're also having them picture you at the next time. So reality check. The patient may also say, "I don't feel better. I don't feel stronger." At this point, you want to be nodding, validating what they said. Additionally, you want to add an and. And that's why it's important to continue with therapy, so you do get better and you do get stronger. That's important to you, right? Why are we saying all this? Well, we're validating what the patient said. They're saying it didn't go well for them. Validate that. But then also update it. Let them know that's okay that it didn't go well. This is why you need therapy, to get better and stronger. Now, by them saying, I don't feel better and stronger, they just told you what's important to them, that they want to feel better and stronger. So you want to validate and update to create agreement. Because you may have thought it went well. They didn't. That's a disagreement. Now you're creating agreement, and you want to end on a yes. So when you ask, isn't that important to you? Well, of course it is, because it was their idea, right? To tell you that. So right now, again, they're assessing you. They're saying, I guess this is important. I guess it's a yes. So even though in their mind the progress was a no, you're ending on the yes. And then after they say that, then you want to reinforce the yes by saying, I know it is. Let's see what you can do next time. Your next appointment is blank. Now, you're not making promises here, and there's no expectation, so you're not increasing their anxiety that you're expecting them to do better next time. Okay, that was for the first example when they agreed that yes, there was progress. But for this one, no. You want to lower the threshold, the barrier. And by saying this, you're placing, again, yourself in their future, and they're picturing you next time in their home. 1099 therapist, I hope you found this helpful. If you did, please like it. Comment what you have learned, share it with another 1099er, and don't forget to save it.